Hello, my name is Mia Gadarov, and I am going to be discussing the topic of gastroesophageal reflux disease, or GERD for short. I will be discussing the causes, the symptoms, and the treatments. I have 15 slides to share with you today and will be taking up the next 6 to 8 minutes of your time. So according to the Mayo Clinic, gastroesophageal reflux disease, or GERD for short, is going to be defined as when the stomach acid frequently flows back into the tube connecting your mouth and your stomach. So I have a diagram here, and to the left-hand side we do have a healthier stomach, so it's going to have this proper band working, which is going to be the sphincter, so it does tighten, not allowing any of these acids to flow up, whereas to the right we do have an unhealthy stomach where the esophagus sphincter does allow the acids to come through due to its weakening. So the causes are going to be mostly diet-based. So we do have what we call trigger foods, so ingesting these foods do tend to give you symptoms and affect your GERD. So they are going to be our acidic foods such as citrus fruits, lemons, ketchups, and then we also have our fattier foods, so they're going to be red meats, our full fat dairies, and all of our fried foods as well. Tightening of the clothes is not going to be necessarily a cause, but it does cause you discomfort if you do already have GERD. It does put pressure on the stomach, forcing those acids to come up through into your esophagus. Women who are pregnant can develop GERD during the full length of their pregnancy, even if they do not have a history of GERD, and it may even go away by the time they give birth. So basically the main cause is going to be the weakening of that sphincter, which is found at the lower bottom of the esophagus. So some of the symptoms, they're going to be pretty basic. You're going to have your heartburn, you're going to have your chest pressure, so those are just going to feel like some tightening in the chest, burning sensations, and due to those you are going to have some difficulty swallowing. Sometimes you even will have some regurgitation of either stomach bile, stomach acids, or even some of the foods that you recently just ate, especially if they were a triggering food. So to be diagnosed with GERD, you do have to see a doctor. So first and foremost, you would make an appointment with your family doctor. They will then point you into the direction of a specialist that they see fit for you. When you do go to your specialist, they are going to possibly run some tests on you just to make sure they see where you're at. Some of those tests are going to be the ambulatory acid probe test. That one is going to measure how much acid is in your stomach over a length of a 24-hour time period. We also have x-rays. This is going to allow the doctors to see if there's any damage done to the stomach or the lining of your esophagus due to the high acidity level. We also have what we call a hiatal hernia that could possibly be there, which is when your stomach slips through into the diaphragm, either fully or partially, causing a lot of pain and discomfort. And then we also have our endoscopy or fluoroscopy, which is going to be when a tiny camera is then inserted into the digestive tract. They can use this to either see the visual damage, or they can even obtain a biopsy to check for bacteria in the stomach, also causing more illness. And then lastly, we have a manometry, which measures how much the esophagus will be moving. So there is going to be treatment for GERD, of course. So for people who aren't suffering as much, if this is only a rare occasion, you can just change your diet, overall live a healthier lifestyle. This goes for people who have GERD as well. Just in general, changing your diet will be helpful. Managing your foods and what you're putting into your body. You also should start working out possibly. If you have excess belly weight that needs to be lost, that can put pressure on the stomach, so it's helpful if you do not have that excess belly weight. Smokers tend to quit smoking because the smoke does trigger more symptoms in the GERD, and in some cases medication will be helpful, especially if bacteria was found in the stomach during one of your testings. So some of the medications you can either get over the counter or you can get prescription. So over the counter medications, those are going to be our antacids such as our Tums, our Rolaids, our Mylanta. We also have the H2 receptor blockers such as Tajamint, HB, and Zantac. And then lastly, we also have our proton pump inhibitors, which are going to be the Nexium and the Prilosec. For more severe cases, people will need to seek prescription medication, and they can get those as well. They do tend to be a little bit more expensive, especially if your insurance does not cover them. And then, of course, in worst case scenarios, when people have a hiatal hernia or damage to the stomach lining or esophagus, they will need to have corrective surgery for that. So personally, I have been diagnosed with GERD about a year ago. I do have a hiatal hernia, which I had explained before, is basically a part of my stomach is now sitting in my esophagus, therefore allowing all of the acids to come in through my esophagus. Despite being 23 years old, this is going to be a lifelong thing for me until I eventually get it fixed. As of right now, I'm living totally fine, so I do not have to get any of the corrective surgery, but over time it will tend to get worse, and as long as I'm following my treatment plan, everything will go swimmingly in the future for me. But as long as I am following my treatment plan, it should not bother me at all now, but later in life I will eventually have to get that corrected. So thank you so much for listening to my presentation. The rest of the time will be allowed for discussion and questions. So first and foremost, I am no expert in GERD. I just research things daily just so that way I am in the know of my own body and my own disease. I do find out new things every day, and it does aid me in having a more appropriate treatment. With that said, not everybody is going to be the same when it comes to their GERD. Some people have different trigger foods than me. Some people are affected by it differently, or some people may not even have it as bad. Everybody is different. Even though the term GERD is universal, there's so many other illnesses that can come with that. So once again, not everybody is going to be treated the same when they have this. With that said, I'm affected by GERD differently daily. I can eat a fried chicken, mac and cheese, buttered toast meal and absolutely feel fine. Then the next day I'll eat completely healthy. I'll have my salad, I'll have a nice smoothie, and I'll be feeling it that night, and I will not be able to sleep due to all of the acid sitting in my throat. With that said, there are some options for when you are sleeping. You have a sleeping block pillow that helps elevate you while you do sleep, so that way gravity can take its course and it will literally just make sure all of the stomach acids will stay in the stomach while you sleep and they aren't coming up through and causing you to want to throw up in the middle of the night. I do have an article here posted by the AMP Journal. They do talk about GERD and the effects of GERD while sleeping. So doctors can provide you with information on GERD on a more broad scale, but the only way you know for sure what will work for you is going to be through a trial and error method. Once again, like I said, not everybody is the same, so that is honestly going to be the best course of action for somebody who has GERD. I know it has definitely helped me when I am trying to figure out what things are. I definitely have a list that I keep of foods that trigger me or have triggered me in the past that I try to avoid. Just because you have GERD, that does not mean you can't enjoy your trigger foods. You can still enjoy them in moderation as long as you're following your daily treatment plan as well. Some people like to turn to yoga as a form of exercise because it's more relaxing and less invasive. So there are a lot of good things that are said about GERD and yoga, and say that there's a lot of different poses that can relieve symptoms and actually help you, but there are also some poses that can actually worsen your symptoms, so you should definitely consult a professional or do your research before trying any of these exercises, just so that way you do not hurt yourself. So right here I do have a video that I will not be showing right now, but there is a video linked here at the bottom. It does show you a couple of the options you have when correcting surgery, when having corrective surgery for your GERD. It also gives you some warnings at the end to show you what would happen if you do not treat your GERD and all of the things that could go along with that. Lastly, we do have a newer treatment that has been brought into the light. It is called the LINX. So basically, like I had said before, at some point or another your sphincter had became weakened, and there is why it is allowing all those acids to come through. Well, the LINX is basically going to be a model of a sphincter, and it does wrap around the esophagus, making it able to close, so therefore you do not have those acids leaking into your stomach again. Once again, thank you so much for listening to my presentation, and I hope you learned some new stuff or added anything to your knowledge that you already knew prior.